I guess if we look at general psychology now, what are some of the main psychological strategies to get people out of depression when they're in that dark night of the soul?
Well, there are a few basic ones. One of the main things is some kind of activity. So we use this term behavioural activation. Doing something, doing anything makes a difference. Walking around the block, doing the washing up, preparing a basic meal, some kind of activity, we call it behavioural activation. It especially helps if we engage in activities that give a sense of achievement or a sense of pleasure. And at first it might be hard to see the achievement or experience the pleasure, but activities that give us a sense of that can help. Certainly the notion of mindfulness, some kind of relaxation, meditation kind of technique, that also helps with anxiety. But mindfulness is also to do with being in the here and now, and maybe our senses turned outwardly. And we know that those things, here and now, senses turned outwardly, is far more helpful than being internal and ruminating, say, on the past or feeling fears of the future. Social supports is something else that's very important. Being open to drawing on the support of friends and others, and that it's tough, but if people can acknowledge having difficulty, hey, I'm really struggling at the moment, I'm not feeling my usual self, and then maybe being prepared to talk to your GP or something like that, to be able to acknowledge one's difficulties, to accept them, and then showing a degree of self-compassion, that can help. But I'd say particularly the activities, looking to pick up our negative thinking and challenging that, partly by getting our attention outwardly, but also picking up some of the overly rigid judgments and overgeneralizations that we have, the negative thinking, and looking to counter that.